Welcome back. Very few people feel like they have a perfect smile, and many will eventually have at least one gap in that smile. Whether it's from trauma or decay, the loss of teeth can have significant consequences to the function and face of your smile. We visited Justice Dental to talk with Dr. Tristan Thompson about some of the options for restoring that smile. Whether it's through trauma, decay, or just hard living, the loss of teeth can mean a lifetime of mouth challenges as well as significant aesthetic concerns. I sat down with Dr. Tristan Thompson to discuss options in dental reconstruction.
It's not uncommon that we have patients come in inquiring about teeth that maybe they've broken or have been missing, or they've just lost over a lifetime. One of the things that, or main words we mention, are dental implants. Dental implants are more or less a root replacement that are made out of titanium, and it is a great way to replace one tooth or multiple teeth. We can go across the entire gamut with those.
There are several options available when there's extensive disease. One of the best options is dental implants, a method to place teeth that may never have to be removed.
Many times people come in with periodontal disease or multiple missing teeth. You may even have a denture that you already have placed due to having those teeth gone. If you're missing multiple teeth, we can strategically place multiple implants, 4 to 5 implants sometimes, or as little as 2, and we can make that denture or multiple missing teeth be replaced. It doesn't necessarily always have to be a denture, but just for example, if you were wearing a denture for multiple years, which many people are, and you're not happy with the fit, you're not happy with your ability to eat, your ability to talk, you're not comfortable in social situations, we can go and place a couple implants, and that denture can then snap on those implants, or it can be screwed into those implants so where you don't even have to take something in and out of your mouth ever again. We do all these cases same day, most often. You come in, we work up your case, we make sure that, again, you're gonna like the final result. It's very important that you know you're a part of this process. It's your smile, it's your teeth. You should be comfortable and happy with your end result. We can then place your implants that we plan on a 3D mechanism. It's called a CT machine or a CT scan. And we plan your case virtually. You come back, we place your implants, and you're off and running with something that snaps in or screws in, allows you to eat apples, allows you to talk and function as if you never lost any teeth.
These improved techniques are possible through incredible advancements in dental reconstructive care.
The technology in dental implants has improved so much over the last 5 to 10 years. We have state-of-the-art equipment here. It's called a CT machine. It's a 3D rendering of your bone and jaw. Once I have that rendering and I can see exactly where your bone mass is in certain areas of your jaw, I will then plan your surgery virtually. All your implants will be placed virtually on a computer. Off that rendering or off that planning, I can then order a stent. That stent allows me to place your implants perfectly with your restoration in mind. These surgeries have to be restoratively driven, meaning we have to know how you want your teeth to look, how we want these teeth to function in order to place those implants properly. It's a very crucial part to make sure the angles and to make sure the implants are placed at the proper depths. And using these CT guided surgeries, we can ensure that to the nearest millimeter or 0.1 millimeter, which is really precise and a really cool thing we can offer.
To get an idea of how these technological advances work, Dr. Thompson talked about a recent case.
This patient presented to our office. She had upper and lower dentures that were not fitting. She was not happy with the aesthetic. She was not happy in social situations when she was out with friends or family and had the dentures moving up and down. So she came to us for her options. And the big thing with the lower denture is that you have your tongue. It's very difficult for a lower denture to stay in. So we presented her options of implants. In this case, she had the option of having 2 or 4 implants where the denture would snap on. A good analogy is that is like a ball and a hitch on a truck. It snaps onto the implants and doesn't move around much. But this patient did not want to have to remove the denture at all. So we planned to place 5 implants in the lower jaw and to have that denture totally screw in. It's called a dental hybrid denture, and so she never has to remove these teeth again. It will totally stay. How this surgery went was that we planned it. We made her a mock-up. She totally liked the aesthetics, and then we could guide the surgery 3D planned off that mock-up. We placed her implants. She'll heal for 6 to 8 weeks. She'll then come back and we will screw in her dental hybrid denture, which will look just like natural teeth. She will now be able to go out in social situations and be very comfortable. She'll be able to eat what she wants. She'll be able to eat apples, steak, things like that, and not have to worry about these dentures moving up and down. It really will change her entire quality of life, and that's something at Justice Dental we can offer. Not only the aesthetics and making you comfortable there, but just your overall quality. Being able to chew your food, be comfortable, and we're really excited about those type of cases.
Dr. Thompson has mentioned a couple of technologies that help them recreate that smile, so we took a tour of their office to see how some of these tools work. The first is a smile studio that helps patients see what they can expect in terms of how they'll look after the procedure, and then the CT scanner, which helps them make the plan.
This is something that we've just started doing recently. It's a smile studio, more or less, where we can take multiple images of your smile on video with you talking, you laughing, and then we can take those videos and we can plan your case virtually and show you what things could look like. It may be something that you're interested in with aesthetics. It may be one tooth. It could be a denture. It could be across the whole board. But it's hard for you to know what's available to you without actually seeing it or knowing. And with this studio, we can use certain lighting, certain recording devices to show you what could be available to you in your smile, in your dental health, and more or less in your comprehensive dental plan. This is a super cool technology that we can offer. Not many dental offices have a brand new CT machine. This machine is very low radiation compared to older machines, and what you would do is take a seat here, we would get you stable, and we would take an x-ray of your jaw. It would take about 4 seconds. This then goes to my computer at my office, and I can plan your surgeries, your personalized surgeries. Everybody's jaw is different. Everybody has different anatomy. It's very important that we know where those anatomical structures are before implants are placed. They need to be planned with a 3D machine like this so that things like your maxillary sinus or your mandibular nerves, or when we place your implants, we're as far away as possible. And those are things that are important to consider with implantology and dentistry.
There's an incredible amount of work involved in rebuilding a smile, but if you want a job done right, success is in the details and efforts from folks like Dr. Thompson. They do stress that there are multiple options available depending on budget and need. The important message is that you don't have to live with gaps in that smile. Not only will you benefit from the functional improvement, but you won't be afraid to show off those pearly whites in family photos. Dental health is more important than most people could even realize, and technology is advancing to keep a healthy, natural-looking smile. More StantonMD coming right up.